It's 2021 and we're still facing the battle against COVID-19. There have been some new developments with the vaccine. I'm Dr. Rob Freelove, Senior Vice President and Chief Medical Officer at Salina Regional Health Center.
Dr. Freelove, thank you so much for being on the show to come give us a COVID-19 update. So we'll let you do that.
Sure. Well, unfortunately, we're still seeing a high number of positive cases here in the community. Still a lot of community transmission going on. Hospitalizations, we're running kind of in the mid-30s most days. We have been down in underneath 30 a few days, but we've also been as high as 44 here in the last month or so. So, you know, that's kind of what we see, high numbers in the community, high numbers in the hospital. Unfortunately, we've also seen a higher number of deaths here in the last month or so as well. So hopefully people are seeing that and doing what they can to try and impact those numbers in a positive direction.
Let's talk about the vaccines that are upcoming and have started slowly.
We received 800 doses that came to the hospital from the state, and the charge was to immunize healthcare workers, hospital-affiliated healthcare workers. So that's what we did with that first group. We got a lot of our frontline workers. We got most of the physicians in town that also work at the hospital come in and take care of patients there. And that's what that first round was intended for. We've received a second shipment of Moderna, the other one that's been approved, and additionally the Health Department and Salina Family Healthcare have also received those. And we're in phase 1A. I guess that's one thing. There's been a lot of confusion about what are the vaccines going for. Each state was actually allowed to kind of come up with their own plan. So the CDC had recommendations, the states came up with what their plans were. So that's why we're seeing a little bit of differences. I know there are some places that prioritize differently and some general public are getting it. Kansas, we kind of went with the CDC recommendations. That's what the KDHE handed down. So it's healthcare workers and staff and residents of long-term care facilities are in phase 1A, and that's currently what we're doing right now. So between us and those other two entities in town, we are focusing on healthcare workers in the community, our staffs, and then in the community at large. And then through the pharmacies, they're getting long-term care facilities, residents and staff at those facilities. So that's phase 1A. That's projected to probably last through January before we start moving down. And then I just saw kind of the plan today. The next phase would be to try and get to people 75 and older, as well as some other essential workers in that next phase. But that's on down the road. So I know that's maybe a little frustrating for people when they hear general public is getting it in other places, but the state's gone the route of following the CDC recommendations as far as the distribution, and that's what we're doing.
Thank you so much for being on the show. And thank you for watching. For more information, please visit srhc.com, like us on Facebook, follow us on Twitter and Instagram.